Welcome to the Speaking of Women's Health podcast. I'm your guest host, Leigh Klekar, the producer of the podcast, and I'm so happy to be back in the Sunflower House today for a new podcast episode. On this episode, I am interviewing Jim Perko. Chef Jim has been with the Cleveland Clinic for 39 years. He has collaborated with physicians to develop the first evidence-based technique-driven culinary medicine initiatives for the Cleveland Clinic. He has developed culinary curricula for 6 patient programs and is the creator and provider of the first Cleveland Clinic culinary medicine patient consult to help patients execute prescribed nutritional plans. He provides culinary medicine education for physicians, residents, medical students, nurses, patients, caregivers, community initiatives, and has partnered with Dr. Michael Rosin, recording over 113 episodes of In the Kitchen with Chef Jim and Dr. Mike. And Jim has participated in studies on cooking and nutrition education for the health. He's a graduate of the Culinary Institute of America in Hyde Park, New York, and was one of the 4 apprentices to the American Culinary Federation, as well as a member of the U.S. Antarctic Expedition, cooking for scientists in Antarctica. He completed nationally to become a member of the ACF 1992 U.S. Culinary Olympic team, winning 5 gold medals from the United States tryouts and competitions in England, Ireland, and with his teammates, he finished 3rd out of 52 teams, wow, from 30 countries in the 1992 Culinary Olympics in Germany. He is the co-author with Dr. Michael Rosin and Michael Krupane in the groundbreaking lifestyle guide, What to Eat When Cookbook. And you can learn firsthand from Chef Perko during a private culinary medicine appointment or shared medical appointment, which we'll dive into in this episode. Welcome, Jim. That was a long introduction.
Oh, thank you. You did great.
Thanks. Well, it just shows your vast experience and how you're an expert in the field that you're in. So on this episode, we're going to be talking about the culinary medicine program at the Cleveland Clinic, as well as provide our listeners with some tips and hope some healthy recipes, and to go along with a column you recently wrote for speakingofwomenshealth.com, which included a lot of healthy recipes to boost your immune system. So let's dive right in. Can you
Absolutely.
tell us a little bit about what the culinary medicine program is at the Cleveland Clinic?
Sure. So it's not just one program. Culinary medicine is really many things. And what helped me learn that was the 39 years working with patients in hospitals
Mm-hmm.
and seeing all the things that they were prescribed or advised to do by their medical providers, and then all the things we would try to do to help them sustain behavior changes. And over decades of doing that, you learn a lot. And so I owe a lot to all the patients I served over the years. So culinary medicine, maybe let me go back a little bit. In 2018, I was at an NIH-funded National Research of Health, funded National Institutes of Health Research Day. I saw 36 different abstracts on culinary medicine, 36 different, opinions of what it is. At Cleveland Clinic, we message culinary medicine to be the evidence-based science. So we try to take the strongest science, the evidence-based science of food, nutrition, and medicine, and we combine it with the joy and art of cooking.
Mm-hmm.
But to make it in simple terms, culinary medicine takes nutritional science and it makes it taste good.
Yeah.
So no matter what diet any patient is prescribed to follow, a cardiac diet, a celiac diet, a Crohn's diet, a FODMAP diet, a diabetic diet, it does not matter.
Mm-hmm.
Every patient should enjoy their food. So if we're working with Taussig Cancer Center, there's a cancer patient who's got a head and neck cancer that is prescribed to be on a textured modified diet, minced and chopped, or even more extreme, pureed,
Mm-hmm.
then that pureed should taste good. And
Right.
that gives that patient quality of life, right?
Right.
So in culinary medicine, all the groups you mentioned, we do that messaging from with patients, with physicians, with students, with communities, with corporate, right? For cancer, for kidney medicine, for any, I mean, I'm a chameleon. I can morph myself into any diet, right?
Yeah.
So when we created the curricula for culinary medicine, we create a technique driven curriculum. What I mean by that is if I could teach you, Leigh, how to make something moist without adding fat,
Mm-hmm.
or how to make something sweet without adding sugar, if you could do that to one thing, you could do it to 10 things. It's a technique. It transcends any diet. It's a
Yeah.
technique, right?
Right.
You know,
That's
a
great.
simple way a simple way to increase flavor is simply increase surface area. If I
Mm.
got a whole onion in my hand, you're going to have a heck of a time trying to caramelize it, right?
Right.
Julienne it or dice it in little pieces, you increase the surface area, increase the area of which you could caramelize the naturally occurring sugars, and it's sweet like a grilled onion.
Hmm.
Works
Yeah.
on anything, a carrot, a turnip, it doesn't matter.
That's really interesting. So, at what point do you get involved? So, a patient goes to their physician, they are diagnosed with, say, diabetes or celiac disease. At what point does your program and do you and your team get involved then? Or how do you get
So,
involved?
well, that's a great question. So, first of all, culinary medicine is relatively new, right?
Okay.
I mean, you maybe the first words probably started popping up about 2008. We did our first pre-culinary medicine program. Dr. Roizen started with Lifestyle 180 in 2008, but it really hasn't come mainstream now in 2016, 17, 18, and so on, right? Now it's like a buzzword. Everybody wants to do it. The key to that is getting the physicians and the medical providers and the doctors to not only recognize it and accept it to refer. So with that, we created shared medical appointments, right? So for a culinary medicine to be part of a shared medical appointment, you got to have the lead physician do the medical management, and it needs to be a physician that is like-minded and believes in the food as medicine piece as well, right? And so what like we have culinary medicine for chronic disease. Dr. Darling's the lead physician in that. She's like-minded. And so she wants to build in to her SMA this component. We've done it in the past for MS with a neurologist. We've
Hmm.
done it for breast cancer. We're part of a brain health study, the MIND study. We're one of the arms in the study, the food piece.
Hmm.
So now it's getting more and more and more. And here I am on a podcast with you, which that didn't happen a couple of years
Yeah.
ago, right?
Yeah.
Yeah, we're pretty soon. I'm going to have uh, the city of University Heights firefighters, 36 first responder firefighters in this kitchen doing hands-on culinary medicine. Why? We want our first responders to be healthy, right?
Uh,
Especially when they got to save people, right? So we're getting there. And now the word's getting out, and, hopefully we'll do more with nursing and so on.
That's
We're
great.
part of the curriculum of the medical school. So we actually have culinary medicine finally, not as an elective, but into the curriculum of the Cleveland Clinic Learner College of Medicine for medical students. We
That's
got one coming up
fantastic.
next Friday. Yeah, it's awesome.
Yeah, that's great. I mean, because as more and more research keeps coming out, there are so many diseases that can be prevented from just a healthy lifestyle, which most includes healthy eating.
Right. So the science is there. People know a broccoli is better than a Big Mac, but how do you get them to eat the broccoli? How do you get them to know how to make it? You know,
Hmm.
if you got broccoli like this here, right? This part's going to cook faster than this part, the stalk, right? And if you overcook broccoli, it's a cruciferous vegetable. So it doesn't smell, it's not palatable, it smells funky, right? Just think of cabbage on St. Patrick's Day that's
Hmm.
overcooked, it's not palatable. Anything cruciferous, cauliflower, Brussels sprouts, when you overcook it. So if you take this broccoli and you just put a score into the stalk part like this, right? Then that allows this part to cook more evenly with the floret. And then we don't want to shock it in cold water, because when you shock it in cold water, this is like a sponge. So if I put it in a dressing or a dip or whatever, it'll dilute that goodness that we put on it. So instead, we blot it dry, we strain it, we blot it dry, so it's al dente, crisp, but dry, so it absorbs and not dilutes whatever you're putting on. They're just little things like that that make a difference.
Yeah, that's great. And we're going to talk more about those tips here shortly. Um, so I want to go back a little bit about the culinary medicine program. Um, so we talked about what it can offer patients, how you get involved, and then sort of what point. But can the patient then now, hopefully the listeners will listen to this podcast. They'll go, yeah, this is great. This is something I could use in my life or with whatever they have going on in their health needs. So how can someone participate? Do they have to get a doctor's referral? Could they just reach out to you? Can they?
Great question. So to participate in the shared medical appointment, they could just go to Cleveland Clinic /integrative medicine, or even better, we got a phone number is 216 448 4325 option 1. And then they could just call and make an appointment. To get into a shared medical appointment, they first have to have a medical visit with the physician that's leading that shared medical appointment, because the physician does the medical management. And that's so important because that's how the insurance company will
Mm-hmm,
cover it. It's considered a physician visit,
mm-hmm,
because everything we do, it's not just me. The great thing about culinary medicine, culinary is the food piece, but medicine's the physician piece.
mm-hmm,
And I think it's so wonderful now that at Cleveland Clinic, we are under primary care. Isn't that great?
mm-hmm.
That wellness and preventive medicine is now part of primary care.
Right.
Yeah.
It is great. Yeah, because for a while it was just wellness, and that was what 10 years before. So I
Yeah.
do agree. It's
Now we're
great that
part of
it's now
primary
under
care. That's
primary
awesome.
care because it's a primary. It should be, first and foremost, taking care of our bodies, eating healthy, because what you put in is, how you feel, what you eat affects how you feel.
That's
Um,
right.
so during this shared medical appointment, what
Anytime you
can
eat, you're
a
either
patient
feeding or fighting
expect?
disease. So during a shared medical
Mhm,
appointment, the goals are they're going to learn nutrition, right? They're going to learn, what foods feed disease, what foods fight disease, right? They learn that information, but what's so important is how can we get a patient to apply and execute that information so they don't compromise the taste of their meals or their health. Because when something's not palatable, or if it's too much work or too laborious or too costly, or ingredients aren't accessible or whatever, then they tend not to do it. So to help a patient
mhm,
sustain those behavior changes they're being prescribed, we want to make everything executable, accessible, and affordable for that patient, and increase their culinary
great.
literacies and skills. A huge part is knife skills. So we show them knife skills, because no matter what diet you're going to do, you got to know how to hold the knife in your hand, and more
Mhm,
importantly, how you hold the food in your other hand so you don't cut your fingers.
mhm. Great. So, I know on your website, so I did a little research before this, and you discussed a little of this in the column that you wrote for speakingofwomenshealth.com, but you have shared many healthy cooking tips just to help mealtime easier and healthier and to absorb more nutrients, like you showed us with the broccoli. What other top tips, your healthy cooking tips, would you say that you think people should know most about?
Well, probably it starts off again, they should know knife skills and learn that, because to get them in the kitchen, we got to make that process less laborious, right?
Mhm.
So to have a decent knife, a decent cutting board, we put things wet underneath our cutting board so it don't slide on them, right? It stays stationary. So we teach basic fundamentals about that. We teach food safety, sanitation. We teach about mise en place, so getting all your ingredients together so you can mindfully assemble that recipe, right? So there's a number of things, and all of that is covered in the culinary medicine toolkit. We give them all these components. Now, when they're ready to cook, we try to show them the and plus they have the right tool for the right job, right? A big
Mhm.
knife for a big job, little knife for a little job. What a good blender or a processor or an implement would be, so they could make this so it's fun, right? They don't have a bad outcome. And then when it comes to tips, the biggest ones is what I mentioned earlier. If we could show them techniques,
Mhm.
I'm making sweet without, I'm going to demonstrate 2 recipes for you today that are going to do that. Because at the end of this podcast, if there's anything I would love anybody that watches this to take home, is I'm going to show them how to make a raisin reduction so they can make something sweet without adding sugar. Because raisins got protein, they got fiber, right? They also
Right.
have something called allulose that can help block, it's naturally occurring in a raisin to help block sugars from being absorbed into our blood. You could freeze it for up to 3 months. I'll get more on that when I demo it. And then I want to show them how to make a cashew-naise. So instead of having mayonnaise, which has egg yolks, which has lecithin and choline in the presence of a saturated fat that could contribute to TMAO or trimethylene N oxide. And that's what's great when people watch our videos I do with Dr. Roizen, because Dr. Roizen will explain the science so they understand it, and then we demonstrate a recipe that goes along with his science. So if he's talking about why you want to moderate your consumption of an egg yolk, we show him how to make something without the egg yolk, right?
Mhm.
And we do that on 113 episodes for all
Yeah.
kinds of different things. So the biggest tips are making moist without fat, sweet without sugar, savory without sodium. Someone
Mhm.
on a hypertension diet can't have no more than 1,500 milligrams of sodium in a day. How can we
Right.
make their food taste good without adding salt, right? How to make dressings with no oil, no sugar, no sodium, and so on, and still taste great. And we
Mhm.
do that, and it's awesome.
Yeah, that's great. I mean, I'm already learning a few things here. We've only been doing the podcast for a short time, but who knew about putting the wet paper towel under the cutting board? I mean, that's a great tip right there. So why don't we, if you're ready, go into the knife skill demo, because I'll tell you what,
Sure.
no one's really ever showed me that, and I've got 3 kids and I'm cooking for them all the time using knives every day, and I'm probably using it wrong. So.
Okay. So, first of all, we got something wet, because if you don't have something wet, see what happens? It slides on you,
Mhm.
right? So that's why we want to take something wet, put it down, and that keeps our cutting board from sliding like so. Now, the main knife that we use in the kitchen with our patients and anybody is an 8-inch chef's knife, meaning it's 8 inches from the heel to the toe. Okay. Now, this particular knife has a half bolster, meaning it's thick up here, but then it tapers down to the same thickness as it does to the blade. All right. So a full bolster, this thick part would be all the way down to the end. And then when you're doing this a lot, you'll get a divot in here, and it's hard to sharpen. You got to put it on a grinding wheel and grind it. Where
Gotcha.
this one, it doesn't happen like that, right?
Right.
Actually, I'm going to see. Hey, Gabby, can you bring me my other knife, please? Um, and so I'll show you what a full bolster looks like. But that way you could sharpen it from heel to toe. Now, what we ask people is we never ask people to hold a knife like this. Thank you so much, everybody. This is Gabby, our sous chef, right here. Okay. And we do everything together here. Thank you, Gabby.
Thank
So
you, Gabby.
this is a full bolster right here. See how it's thick? And this was my issue knife in 1977 at the Culinary Institute, and I still got it. But the reason they did it back then was you would break chicken bones. It acted like a cleaver. Nobody does that anymore. Everything's fabricated. And you'd have to grind that down on a wheel. This one you don't. You could just put this on a steel or a stone, and it sharpens evenly. So instead of holding a knife like this, three fingers on the handle, thumb and index on the blade, it's like choking up on a baseball bat. Gives you
Hmm.
more dexterity and control. The harder part, how you hold the food in your other hand. So
Okay.
you want to indent your fingernail under your first knuckle. So if you hold food, okay, I'm going to come back around. All right. So if you hold food like this, that's how you cut your fingers. So I got a piece of celery here. If I'm on my knuckle, oh, and the other part I'll tell everybody, a lot of people that come in our kitchen, they always cut with the tip of their knife. If you just take your knife, put the tip, press like this, all these muscles are tense and tight. If I did that all day long, it'd drive me crazy. Instead, if you cut with the back part of the knife, you got good body posture mechanics, right? Back part of the knife, you cut like this, all that tension's gone.
Mm.
So on my knuckle, back part of the knife, I cut on the downswing, and that's how and you'll never cut your fingers. See,
Mm.
you're just cutting just like so, and you get nice slices, right?
Yeah.
So if you want to make, a dice, first you got to make a strip. But see how I'm always on my knuckles. And then a large dice is a large slice and then a large strip. And a small would be a, medium, medium, and small, small. Then if you want to make a dice, if you're always on your knuckle, you can't cut yourself. But
Okay.
if you, and then it's safe. That's why I don't have to look. No, because it's like,
Wow.
playing music by ear, right? So then you get all these nice dices, okay? So that's the main thing. Now, when people got a melon at home and they go to peel it, instead of throwing the peels away, practice your knife skills on
Mm.
slicing and dicing in strips. Because once you master this, they'll serve you the rest of your life.
Mm. And I'm sure it probably makes preparing if you're doing a lot of preparing and cutting, it makes it go quicker. Because I feel like sometimes when I'm doing a lot of cutting vegetables, it could be a half hour. I mean, it's taking me a long time, and then I'm already over, cooking at that point.
They're now doing cooking camps for kids. They've been doing it a long time.
Yeah.
Um, and actually another thing I did, it's kind of pre-culinary medicine. I started a program called Food is Knowledge, age appropriate for pre-K and K for a 5-year-old that goes in schools. And the
Huh.
only way to get that in schools was integrates food nutrition with academics. Food is math, measuring, counting, weighing, timing, buying, selling. But that could be a whole nother podcast and conversation.
Yeah,
But the
that's great
point
though.
being is if you cook with kids, they start to learn this so they can learn good habits, safe habits,
Yeah.
and you can get them tuned in early. So when they go to college, maybe they might want to make something for themselves. And when you cook a meal, Leigh, when you cook a meal,
Mhm.
anybody,
Mhm.
you're not just feeding your belly.
Mhm.
You get functional exercise. You're going to the store, you're shopping, you're buying, then you got to put the stuff away. If you got a garden, oh my God, I do yoga when I pull weeds in my garden because I'm kneeling here and I'm stretching to pull that weed, right? You get the mindfulness, you're outside, all that forest
Yeah.
bathing they talk about, right? Yeah, yeah. There's so many components.
Yeah.
Hospitality, sharing and carrying a meal with someone you love. You break bread together.
Mhm.
A lot of physicians will talk about aromatherapy, essential oils
Mhm.
in the kitchen, ginger, cinnamon,
Mhm.
garlic. You get so many aromas, which, if you're with a child, creates food memories formed in childhood and carried for life. You got them, I got them, everybody has them of our parents and grandparents growing up. I
Yes.
got 4 grandsons. You know what they're
Oh.
going to remember about Papa? His kitchen smells like garlic, right?
Yeah.
So, yeah. So
Oh.
that's the knife skill part. Yep.
Well, that's really, really helpful. I mean, and like you said, you made so many good points too of starting young, because then they can make their own food. They know how to do it properly. They know how to do it so it's easy. It's not gonna take them hours. They can put together something healthy in a half hour.
Plus, you learn a lot. So even though, they're maybe older, we're starting with that 5-year-old. When you go food is math,
Yeah.
you got to measure. So
Yeah.
all the ingredients that go in, but then what is the yield going to be? What is
Mhm.
the final outcome? You might
Mhm.
have a half a cup of spinach and a half a cup of kale and a pear and a banana and an orange. But after all that stuff is pureed, what's going to be the final yield? So they learn
Mhm.
that piece of it. What's
Right.
the portion size? How many
Mhm.
portions will it make? Now,
Right.
what are the nutrients that you get out of all that? What is the
Mm.
cost out of that? How do you store it? Food safety, sanitation. How do you keep this
Yeah.
safe? There's so many lessons you could learn.
Yeah.
And when you
Oh,
cook
love it.
together like that, oh my God, the conversations you could have, it's endless.
Yeah, yeah. Especially, I mean, I've got 2 teenage boys, and, they're like, "Oh, how long do I put this in for?" Or how much making a smoothie. I'm like, and I'm thinking in my head, how do you not know? You just throw a bunch of stuff in and, figure it out. But they, they want to know, which I guess is a good thing. Should they put a half cup of the orange juice or how much yogurt? Right.
Let me give you a smoothie story.
Ooh,
Okay.
okay.
Food is knowledge. This is a true story. We did food is knowledge. We did it with Cleveland schools, right?
Okay.
And the 2 schools that we pilot, we did a green smoothie, right? When you go into the school, I gave them my recipe. I go there, they had 300 already made and pre-poured. By the time I got there, I taste everything. I go to taste it. It was god awful. My recipe was god awful. I go, let me see what you did. Here's what they did wrong because they had to make a lot, right?
Right.
They bought the kale in big bags and it was
Mhm.
wet,
Mm.
right? Same thing with the spinach, right? Because they bought institutional bags and they were probably older and they were all wet. You know what happens when greens get wet? They get real funky. The bananas weren't ripe, the
Mm.
pears weren't ripe, and they didn't peel the pith off the orange. And
Mm.
I don't want to add sugar to this. Now, if you just have the pith on a citrus, it's real, real bitter. You got to
Okay.
peel that because I want this smoothie to be sweet.
Mhm.
So I made them dump all those because a kid, you only get one shot with a kid. If this kid makes a frown and don't like it, that kid looking at him ain't even going to try it, right? Yeah.
That's right.
So made them throw it all away. We went to the store, bought new stuff, and then we did it right, and it was great.
Oh, good.
There's a saying in the culinary world, good in will help you get good out.
Mhm.
So if you buy stuff, you handle it with integrity and properly, you get a great outcome.
Mhm. Yeah, that's great. I mean, and I actually didn't really know that your greens shouldn't be wet. I mean, because I'll buy it frozen sometimes because of work and all this going on, and it's just not the same. And then I'll buy it already packaged, at the store because it's so convenient. I'm like, oh, that's sweet and it tastes so good. How come mine can't taste like that? So we'll
Yeah,
have to get one of
there's
your.
actually there's science on like carrots. Sometimes people buy carrots already cut up, those little ones in bags and everything. They're already degraded.
Yeah.
The nutrients that are soluble to heat, light, and air, right, already degrades nutrients. So when I buy carrots, if I get the green tops on and they're fresh, at least I'm a little bit fresher, right? And then anybody that's able to have a garden, it's a great thing to do. But the more you could do when you make your own, when you cook, you pick the food, you decide the source where it came from, right? You control that,
Mhm.
and
Mhm.
you control how it's made and prepared. When you buy something somebody else did, you lost all that control.
Right. Yeah.
And
Very good
and
point.
once you make something that's like, wow, this is really good, when kids get used to doing that, they're not going to want any other stuff because you created a benchmark for what good is, and it's
Yes.
hard to go back,
Yeah.
right?
That's great. Do you want to go and show everybody the raisin reduction recipe and
Absolutely. Okay, so we just took raisins, we put them in a pot. It's real simple, equal
okay.
parts. A cup of raisins, cup of water, we put it in a pot, right? And then this one here is already rehydrated. And I'm going to show you the water that we got from it, okay? The liquid, which is now a raisin broth, okay? And I'm not going to do this whole thing because it'll be loud in the interest of time. But this is the broth. I'm going to see if I could get a spoon and bring it up so everybody could see. So those raisins were already cooked. This is what the broth looked like. Okay. So we
Okay.
reduced down, if you took a cup of raisins and a cup of water, or 2 cups of raisins and 2 cups of water, you reduce it down. That one was a double batch. Okay. And that's what it looks like. Now you got this raisin broth, right? All right. Okay. So now we put that in like so. And this is a high-speed blender, but it helps to have the right tool for the right job, but you could do it in any blender. What I like about a Vitamix is because it has a variable speed, meaning I could start slow, ramp it up, and I got this tamper to go down. So I put it on, I go slow, like so, right? And I just keep going, and that's all I do. Okay, so I would let this go about another minute,
Okay.
and then when I'm done, this is what I would get. And we make this ahead of time. This will freeze for up to 3 months easy. And that's what it looks like. Now you
Okay.
use it for savory. You could use it for baking, but this way, instead of adding white sugar, brown sugar, honey, agave, whatever, you're getting protein, fiber, you're getting allulose, right? Antioxidants that's in the raisin. You could also do it with prunes, right? People do it with dates and so many things. We did the raisin reduction because they're affordable.
Hmm.
Most people have them, are familiar with them, and plus they do have the allulose. Now, I'll go. You want me to go into the cashew nays now and do that one?
Yeah, I just had a question just for my,
Sure.
selfish reasons for
Yeah,
when
yeah.
I bake in the future. So if I'm making a recipe, I make a zucchini bread recipe. It's my grandma's. Kids love it, and it's a good way to get the green vegetables in there. Would I substitute because it's about 2.5 cups of white sugar this recipe calls for.
Wow,
I know, right?
that's a
So it's like,
lot.
I
Yeah,
know,
yeah.
and I just took away all that wonderful green vegetables, like by putting all that sugar in. Would I use 2.5 cups of the raisin reduction?
I probably would start with half
Okay. Okay.
because, first of all, the raisin is already cooked down. So if you had 2.5 cups of whole raisins, by the time you cook it and
Yeah.
puree it, it's not 2.5 cups
Yeah.
anymore, right? That
Right,
goes
right.
back to the yield. Yeah. So, you know, exactly. I don't, depending how many loaves or how much you're going to make, start with less because you're going to get a flavor that'll come off the raisin, right? You're
Mhm.
also going to get moisture that's going to come off
Mhm.
that raisin, right? You're adding
Right.
moisture to it, which if you control it, it's a good thing because that could add moisture without adding oil or fat
Exactly.
is
Right.
exactly right. And so the more that you get into doing these things, depending on what your recipes are, the next time you go, I think I need a little bit more, or I think I need a little less, and you
Okay.
write those notes down. And then
Yeah.
after a while, boom, you're going to nail it, right?
Great.
Yeah. Okay, okay. I'm going to get this out so I don't forget. Okay,
Yes.
this is going to be here. I got to do this. I brought this, and then I'll show you how we do this because this is real deal life's happening, and it was
Uh,
just a last minute thought. Okay,
okay.
you want me going to cashew nays?
Yeah, so this is going to be a way to add flavor but reduce your sodium intake, correct? With the cashew nays?
Well, yeah. But more importantly, if you have mayonnaise, again, you get the yolk, you got added oil, you
Mhm.
got added sugars, right? And then you get the lecithin and the choline and all those things that are going on in there. And I got to these are the wrong gloves. I got to get bigger gloves. I'll be right
Okay.
back.
Yep, always having the
Okay,
right
and these
tools,
are
like you
mine. All
said,
right.
having everything out and
No,
ready.
yeah, no, those were Gabby's gloves. That's why I was having a hard time. Now I got mine. Okay, we're good. All right, so now if you have mayonnaise, you got the egg yolk, you got the oil and the added sugar. So some people, instead of having that, they might get vegenaise. But
Mm.
when you look at the nutritional label, and everybody should read the ingredients and the nutritional analysis, main ingredient is oil, okay?
Mhm.
And it's 80 calories a tablespoon because it's mostly oil,
Yeah.
okay? And actually, the, one of the problems with vegenaise, it's so good you could eat it with a spoon.
Oh,
So
really?
you're eating a lot of, it's pretty good,
Yeah.
but it's a lot of oil, right?
Yeah. Yeah.
And, what's the three addictives in food? Sugar, sodium, and fat,
Hmm.
right? You like ice cream?
Yes.
That is the trifecta. It has
Yeah.
all three.
Yeah.
That's why it's so easy to eat. So that's why we want to help people to show them how they could enjoy food while reducing the amount of added sugar, sodium, and fat, because those are the three main addictives in food.
Hmm.
Okay, so now we're going to go back around here. All right. Okay, so now we got our processor, our blender rather. Okay. Okay, so we got cashews, if you get them, soaked overnight. A cup
Okay.
of cashews soaked overnight, right? Then we got our garlic, fresh garlic. Okay. We got dry mustard, a little bit of cayenne, and we got salt. We got a little bit of raisin reduction here that I'm going to put in. So you saw the raisins, okay?
Right.
So that's going to go in, our raisin reduction. Then we got some water, plain water, okay? And you have all these recipes that we gave you.
Yes, we're going to put
Distilled,
the link to all the recipes in the show notes for all of our listeners out there.
distilled vinegar, apple cider vinegar, and then we got lemon juice, okay? So
Okay.
that's all that goes in there, right? Now, another one fell down. I'm going to use this one, which is fine. Okay, so now we're going to do the same thing. We're going to put this on. See, that's why I love it. You could start at a slow speed. I'm going to ramp it up.
And so for those listening out there right now, we've got Chef Jim who's blending his cashew nays recipe. And it's a way just to, add some, instead of using mayonnaise, this is his recipe he's created with cashews. That's a lot healthier.
Okay, so I would normally let this go maybe another, minute or so, but
Okay.
I want to show you real fast. I got one done here, and then I'm going to show this. Okay, so here we go. Now this needs about another minute, but look, see,
Oh,
right
yeah.
there. Now
Wow.
it's a little grainy because it needs another minute, but
Right.
this one is some I had already done. It takes on the consistency of
Yeah.
cream cheese.
Yeah.
So you could turn this into tartar sauce. I
Yeah.
could turn it into salad dressings. This is absolutely delicious. And this is the part I want to show you. One of the things for breakfast in the book I did with Dr. Roizen, my wife and I make this every week, all the time, 100% whole grain pumpkin rye bread.
Oh, yum.
And we put the cashew nays on it. And this is delicious. It's
Oh, that's,
outstanding.
yeah.
Yeah, whole grain pumpkin rye bread with cashew nays.
You're
So
making
this
me
was my
hungry.
breakfast. Yeah. So that's our part on that.
That's great.
Yeah.
And as I mentioned, we'll have those recipes in the show notes, and we'll also put them up on our speakingofwomenshealth.com, the website. That way everyone out there can, start making this and, substituting some of that like mayonnaise and for this and adding it to, like you mentioned, your pumpkin rye bread, turn into tartar sauce. So,
Oh yeah, it's so easy. I mean, if you made a fish sandwich, you got a tartar sauce on there, but you could use it
yeah.
just like you would use cream cheese as well. It's
Okay.
outstanding. Yeah. Remember, we tell people don't think about what you can't have, shouldn't have, or advise not to have. Instead, think about all the things you can have.
Right. Right. And this is,
And then,
I live life in moderation. However, sometimes you just have a craving, and this is a great way to substitute those bad foods.
oh yeah, just like we make a vegan milkshake, instead of having ice cream, you can take a frozen banana. It's like ice cream. You can put it through a Yonanis machine. It's like soft serve ice cream.
Mm.
You could cut it in a little coin, when it's ripe, peel it, and then cut it in, a little, disc, skewer it, freeze it, And then after freeze, take it out and dip it in 70% cocoa, dark bittersweet chocolate. Now it's like a
Mm,
Klondike bar. And then you could sprinkle toasted walnuts or pecans on that before the chocolate sets up. And now it's like
yeah.
a Captain Crunch type bar, right?
Yum.
Think of all the things you can do. It's fun.
Absolutely. I mean, this has been so great. I mean, we'll have to have you back because there's so many more recipes and tips that we can get into. Um, and as I mentioned, you did that column for us with more recipes. So I really encourage our listeners to go check out Chef Jim's column on speakingofwomenshealth.com to get additional recipes. We'll be putting the cashew nays, the knife skills, you mentioned your other toolkit. We'll have all those links and QR codes all in the show notes for everybody. Before we wrap up, is there any last final words or tips that you want to share with our listeners?
Yeah, so I guess the biggest ones I'll go back to think about all the things you can have that you're advised to have and not what you can. If you're being told to moderate your consumption of red meat, thinking about it will just drive you nuts, right? So if
Mm-hmm.
I go back to the celiac patient, they can't have gluten, so they can't think about it. Instead, they
Mm-hmm.
want to think about all the grains that are gluten free and what they can make from that. So whatever you're being prescribed to do, that's your go-to world, what you could do. And then the other part would be you can't love what you don't know. So how does that celiac patient know they're not going to like millet if they never had it or tried it, right?
Right.
So give things a try
Yeah,
and have fun.
I love that.
Practice your knife skills.
That's right. I will. I will tonight. Well, thank you so
Uh,
much, Jim, for joining us
okay.
on the Speaking of Women's Health podcast. It's been great.
Oh, I forgot to mention I do individual culinary medicine consults
Okay.
where I'm the medical provider. Now, I think I might be the first chef to ever do this because chefs don't chart in a patient's medical records in Epic. And
Right.
this does that, right?
Okay.
But it is out of pocket.
Okay.
So the shared medical appointments are covered by most insurance companies,
Mm-hmm.
right? Because it's a physician visit. Culinary medicine consult, our government doesn't recognize it.
Mm.
So it's out of pocket. But
Okay.
there, I work with the medical provider, a PCP. I look at it, whatever diagnosis, what the prescribed, dietary advisements are, and then I could work how to make it and taste good. Then they could come in this kitchen. We have a lot of the stuff ready, and then we just go at it and cook. So that when they go home, okay, I think I could do this,
Yeah,
and that's a
that's great.
culinary medicine consult, right?
Okay. Great. And so
And
can
they would
they,
just call the same number, same
okay,
number.
was just going to ask. Perfect. And we'll put that number as well in the show notes for everybody. Um, Well, thank you. We're going to wrap up this episode, and I want
Okay.
to thank our listeners for tuning in to another episode of the Speaking of Women's Health podcast.
Gabby, want to say goodbye?
And Gabby works with Chef Jim,
Yeah.
one of his chefs in the kitchen. Thanks so much, Gabby. We appreciate everything and for helping us with the episode. And we'll have to definitely have you both back.
Thank you.
Yes. Thank you. Thanks, everybody, for
Okay.
listening.
Bye-bye.
Bye bye.